this is a fantastic question because in both the coding and billing world, you're going to need to know what an ABN is. And the ABN stands for Advanced Beneficiary Notice, and this deals with Medicare. It's a Medicare waiver, actually, and nobody's going to say Advanced Beneficiary Notice. They're just going to say ABN. And the only people that have to deal with this is Medicare patients. But I got several little points here about ABNs and who and why they use them. It's a written notice from Medicare. It's on a government form. Everybody uses the same form. It's called a CMS R131 form. And because it's a standard form and it always looks the same, that if you have someone fill it out for you, once you've had one person fill it out for you, it's real easy to explain. What it tells the patient is that Medicare may deny payment for a specific procedure or treatment, and that you will personally be responsible for full payment if Medicare denies the payment. And that's why it's called an advanced beneficiary notice. They're saying, in advance, we want you to be aware that Medicare may not pay for this. And if they do not pay for it, then you will be responsible for the payment. So that allows you to decide if you want to accept or refuse the ABN. Okay? And you may not want to be liable for whatever it is that the doctor is wanting to have done. But if you decide that you don't want to sign the ABN, you need to let the doctor know. You need to tell the patient that if you don't sign the ABN, that's fine. It's up to you. But let's let the doctor know that you're not going to sign the ABN because he needs to be aware. There was a reason why he wanted this treatment or this procedure to be done, and that you may want to talk to him about that. Now, just because you sign the ABN doesn't mean that Medicare is not going to pay for it. It just means that they may not pay for it, and they want you to know in advance that they may not pay for it. And let's see. Now, some people want to know, how come I keep getting these ABNs and I have to keep signing them? Well, that's because Medicare only allows certain things to be paid for a certain amount of times. So the way they put it here is certain items or services that are covered by Medicare are only covered up to a certain number of times within a specified amount of times. Examples of these are frequency limited services include like laboratory tests, some preventative screening tests, and vaccinations. If you receive an ABN that gives a frequency limit as its reason, it means that Medicare will not pay if you exceed that limit on the service. An example of this, and I'm not sure if this would be one, but it could be like it might be flu shot, pneumonia shot, and your chickenpox shot, or not your chickenpox, it's the shingles shot. Maybe it only pays for you to have a certain number of those vaccinations in a year. Maybe you can have 2, not 3. I don't know, I'm making that up, but it might say you can have, 3 vaccinations in 1 year, or 2 vaccinations in 1 year. You get to choose, or you and your doctor get to choose, but they're not going to pay for 3. And there could be all kinds of things like that. Or you can have X amount of lab tests in 1 year, or in 1 month. Now, this came up as a question that I've heard before. Do ABNs mean that Medicare is reducing coverage? And it does not mean that they are reducing their coverage. It It's only if and when Medicare does deny a claim do you become liable for paying it for it personally for the service or the item. If Medicare decides to pay the claim, you've lost nothing by signing the ABN. And that's important to know and let your patients know. Again, it's just for them to know that if Medicare isn't going to pay something, then they in fact would be the one that is responsible for paying. And often they have a secondary insurance coverage that picks up the balance. But if they're ever in question, they can go to the website www.medicare.gov, and that gives a full explanation of ABN. You can go into the search site there and put in ABN, and it will give information about that. And I would encourage you to have your patients go there and look that up if they ever question what an ABN is, or if you ever question what an ABN is. But you need to know what one is, and in fact it's probably going to be a test question. So it would be nice that you know what that is.
Need more medical certification training? Go to www.codingcertification.org.